The ACT government is pushing for a nationwide approach to trialling and legalising medicinal cannabis. Proposals to allow chronically or terminally ill patients to use the drug are being considered by various governments across the country. Some patients and their families say reform is urgent as they're being pushed to break the law. Carl Smith reports.
We can't tell you Brendan's full name. Just by showing his face on camera, he's putting himself at risk. Because earlier this year, acting out of compassion, he broke the law.
I was confronted with the terrible situation where if you want to use marijuana medically, you need to go to recreational sources.
Just over a month ago, on the last day of winter, his wife died of cancer. In her final months, traditional pain relief medication wasn't working.
They were sort of knocking her out. We found the marijuana really helped because it lifted her mood and helped her sleep and, various other things. Didn't have side effects.
But he was forced to find the drug for her. He says some in his situation have to navigate drug dealers on the street late at night.
And, go and score a deal off a pimply adolescent in an underpass and, they got their wallet full of cash. It's a very risky scenario.
Nationally and in some jurisdictions, including the ACT, the Greens are trying to pass legislation allowing the drug to be used.
There's clearly a momentum to allow the legal use of cannabis for medical purposes. I think the community expectation is very strong and there's plenty of evidence to show the positive benefits.
And ACT politicians say it's time for the Abbott government to step in.
The Commonwealth is best placed to lead the discussion and to look at what some of the issues are and manage a nationwide clinical trial.
In the meantime, they're hoping to join a New South Wales trial, potentially bringing a faster solution to patients.
It's great to be making some progress, but if it's going to take 5 years, that would be lamentable.
The ACT government has written to health ministers around the country and hopes to raise the issue at this week's COAG Health Council meeting. But they aren't expecting a quick solution. Carl Smith, ABC News, Canberra.